While breast cancer is the most common diagnosed cancer in women, lung cancer leads to the most cancer deaths in women in America. According to the American Cancer Society, about 28% of all cancer deaths in the U.S. are from lung cancer, making it the leading cause of cancer death and preventable death for both men and women. Researchers from the American Cancer Society have found that screening former and current smokers who fall within guideline recommendations could prevent 12,000 lung cancer deaths a year in the United States. That number is based on the National Lung Screening Trial, which found that heavy smokers who got low-dose CT scans had a 20% lower chance of dying from lung cancer than those who got standard chest X-rays. It is estimated that 80% of lung cancers could be cured if detected at an early stage. We caught up with Drs. Kittyle and Brabham of Florida Hospital Waterman's Cancer Institute at a recent seminar on the importance of this new advancement in lung cancer screening.
About 85% of lung cancers are associated with smoking. That's the primary risk factor for lung cancer, so a study was conducted to see if low-dose CT screening would be useful in identifying lung cancer at an earlier stage, thereby reducing morbidity and mortality.
Prime candidate for having this lung cancer screening is anyone with a history of smoking. Typically the rule of thumb is 30 or more pack years, so that's 1 pack a year for 30 years or 2 packs a year for 15 years. In the ages between 55 and 74 is what they included in the study, so roughly in that age range.
A standard CT is done when the exact cause of the pain or symptoms are unknown. So it uses an appropriate dose for imaging of all of the soft tissues, the lungs, and the bones. So the goal of low-dose CT is just to identify the pulmonary parenchyma and try to identify early lung cancers. So as such, it's approximately 1/3 of the dose of a traditional CT.
I'm really excited that this technology is available to Waterman. I think it will ultimately be a major step for us in reducing deaths from lung cancer.
The beauty of this scan is that it's enabling people who may not otherwise have medical care to come in and get a low-dose, inexpensive CT scan to try to identify cancers at an earlier stage. The earlier you identify a problem, the easier it is to treat and the increased likelihood that they'll survive the disease.
For more information on the treatment options and services offered at Florida Hospital Waterman's Cancer Institute, you'll find them by clicking the Lung CT Story link on our homepage, yourhometownhealth.com.